The Self-Care Learning and Discovery Series is back, and it's bigger and bolder than ever. This is the premier self-care event of the year, bringing together self-care enthusiasts of all backgrounds and disciplines from around the world. The World Health Organization defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. We also know that self-care means different things to different people. What does self-care mean to you? You'll have ample opportunity to reflect on this question during the Discovery Series, with more than 20 interactive virtual sessions organized by self-care experts worldwide. The Discovery Series will elevate cutting-edge research, programming, and advocacy insights across a wide variety of self-care topics, and we encourage you to attend as many sessions as possible, especially on topics that may be new to you. The Self-Care Learning and Discovery Series, a core activity of the Self-Care Trailblazer Group, is organized by the White Ribbon Alliance in partnership with co-sponsor organizations and esteemed steering committee members. We also want to thank all our session organizers and presenters who have voluntarily dedicated their time to curate this event with us. We are pleased to share that every session will offer live, simultaneous interpretation in French, Spanish, and English. To access the interpretation, simply navigate to your meeting controls located at the bottom of your screen. Click on the globe icon labeled Interpretation and select the language you'd like to hear. Joining from your phone, tap on the ellipses to find the interpretation feature and then select your language. Please note, you can switch languages at any time throughout the presentation. The session is now about to begin. Don't forget, whether you're working to influence policies or programs, advance universal health coverage, or improve your own self-care, we hope that you will take the learnings from today's discussion and apply it to your own work. To that end, we invite you to continue the conversation and take action with us by becoming a member of the Self-Care Trailblazer Group. So get curious, jump in, and share your ideas and insights with us. We look forward to advancing self-care together.
Hello, everyone, and welcome to today's Self-Care Learning and Discovery Series roundtable and presentations focused on the topic of self-care and climate resilience. I'm Nicole Lower, your host for our 90-minute session that will span presentations from our three amazing speakers, as well as a roundtable discussion to explore the presentation content in depth and a few other conversation topics that will circulate around the theme of self-care and climate resilience. 3 housekeeping notes before we begin. First, at the end of the session, you will be prompted in the chat box to take a post-session survey. If you could fill this out, it would help improve next year's experience. It would be greatly appreciated. Second, there will be a 35-minute roundtable at the end of the presentations. This is open forum, so while we have prompts, we'd love for you to come curious and with an open mind and submit questions yourself. We will share a Jamboard periodically throughout the sessions and come back to them during the roundtable. Third, there's an interpretation available. So click the globe on the reactions or near the reactions and the AI companion button to enable interpretation. So transitioning to our esteemed presenters, our presenters today offer a depth and breadth of knowledge and experience at the intersection of self-care and climate resilience. And I'm so thrilled that they'll be sharing their work with us today. First, we'll hear from Dr. Carmen Logie, who will be presenting on the impact of climate change and self-care and the sexual and reproductive health space. Next, we'll hear from Niall Nair, who will be presenting the AmeriCare's Climate Resilience Toolkit and the impact of climate change on nutrition. And last, but certainly not least, we'll hear from Rafia Raf on the topic of Birth in a Burning World, a report on extreme heat, maternal health, and self-care in Pakistan. All that said, let's get started. Dr. Carmen Logie is a professor at the Factor Inuash Faculty of Social Work. She is also an adjunct scientist at the Women's College Research Institute, adjunct professor at the United Nations University Institute of Water, Environment, and Health, and research scientist at the Center of Gender and Sexual Health Equality. Dr. Logie, welcome to the virtual stage.
Thank you. Thank you so much for having me here today. Everybody can hear me, I'm assuming. I just want to note that there's a lot of co-authors on the work that I'll be presenting, and I will share their names afterwards. But what I'll be presenting today is from several years of community-based research, and you can follow me on my Twitter handle there. I actually think that you have to advance the slide now. Thanks. So an overview in my 15 minutes, I'm going to be briefly talking about the conceptual frameworks that link climate change with sexual and reproductive health, or SRH. I'll be sharing briefly 2 case examples, and then I'll conclude by discussing what are the implications of what we've learned about climate change and sexual and reproductive health outcomes for climate-informed self-care SRH. Next. So first of all, I became interested in really how climate change affects sexual health about 4 years ago in 2019, working in Uganda, where I've been working since 2017, both with urban refugees in Kampala, Uganda, as well as since 2019 with refugees living in Bidi. Next. So we know there are about 2 billion people today who have insufficient drinking water, who have insufficient food, and over 600 million have insufficient sanitation. And climate change directly contributes to worsening food and water and sanitation insecurity. Next. And there have been some theoretical models that have been exploring how might we understand the linkages between climate change, extreme weather events, and sexual and reproductive health. For instance, the ecosyndemics approach posits that social structures change with the effects, for instance, of highways and dams and other climate events, natural disasters, and they also change ecosystem structures and population health dynamics. Lieber and al. On the right created this model looking at how might climate change be directly related to both HIV prevention outcomes as well as HIV care outcomes via pathways such as increased migration, increased infectious disease prevalence, erosion of health infrastructure, and increase in food insecurity. Next. And we've also seen some recent systematic reviews, for instance, documenting pathways from extreme weather events and increased sexual and gender-based violence, and also how drought is linked with poor HIV treatment adherence in African context. My team has been looking at climate change and sexual health, and we have a scoping review protocol, which is published, and the actual review is in revision. So hopefully it will be coming out soon. And others have been linking climate justice to contexts of period poverty. Next. We've also applied the resource scarcity framework in our work in Bidi refugee settlement in Uganda to look at how these structural drivers, such as ecological factors like climate change, seasonality, drought and floods, socioeconomic factors such as poverty and education, and social factors such as gender norms, shape people's experiences of water, food, and in this context, firewood insecurity, and how those ultimately shape well-being, including exposure to various forms of violence. Next. And on the right, you'll see a graphic abstract from our research where we specifically looked at water insecurity in Bidi and pathways to sexual violence. And that included the relational context where women and girls are often the people who collect water and firewood in families in this context, a symbolic context where women have less power in relationships, and the material context where in this setting, there's limited visibility, limited lighting, long distances to access, and insufficient water availability. Next. And so I'll be presenting the first case study, which is with urban refugee youth in Kampala, Uganda. We've been working, as I said, for the last 6 years. Next. And we've published a lot. I'm not going to go into the methods, but you feel free to look up our methods. We have a longitudinal cohort study with urban refugees living in 5 informal settlements. It's a community-based collaboration with Young African Refugees for Integral Development, a refugee-led organization. We've been documenting the interaction between violence, substance use, and also food insecurity. And yeah, you can go next. And with regard specifically to food insecurity, we have shown that it actually is associated with reduced HIV testing, increased trajectories of depression, and increased involvement in transactional sex. Next. But there's been less studies that have looked at both food insecurity and water insecurity and their co-occurrence and how it might be associated with a range of sexual and reproductive health outcomes. So I'm presenting data here, which is on food insecurity and water insecurity in the pandemic in 2021 with this cohort of 340 youth. We found that reduced sexual health access measured by reporting disruptions to a range of outcomes, including access to HIV testing, access to STI testing, access to contraception, access to condoms, was associated with both water and food insecurity. Past 3-month transactional sex, also associated with food and water insecurity, and unplanned pregnancy, which affected almost 1 in 10 participants in the pandemic. And water insecurity was also associated with lower condom self-efficacy and lower sexual relationship power. So really less control over your own body and your self-determination. Next. I'm not going to go over this whole slide, but I just wanted to note that in this sample of 340 youth, 65% reported food insecurity and almost half, 48%, water insecurity, and 37%, more than 1/3, reported both food and water insecurity. Next. And I've already reported these results, but I wanted to note the bottom figures are people who experience both concurrent food and water insecurity. They also report reduced pandemic access to SRH services, increased unplanned pregnancies in the pandemic. And next. And here, almost 4-fold higher odds of reporting past 3-month transactional sex, which is more than folks who reported water insecurity alone or food insecurity alone. Next. And here, as I noted earlier, condom self-efficacy and sexual relationship power are both associated with water insecurity, but they're also associated with food and concurrent water insecurity. Next. And just a couple of examples regarding our qualitative findings with in-depth interviews with 24 refugee youth and focus groups with a total of 24 youth. Next. So just two themes I wanted to highlight was that a lot of people discuss climate migration. That can be internally and it can be among refugees as well. So you see that in this quote, a lot of adolescents leave their families because of climate change, because of floods, because they're staying in slums. And then with that mobility and migration, they often become involved in transactional sex. Below, transactional sex is not just for food and water insecurity. It can also be for menstruation, hygiene, product needs. Next. You can go to the next slide. So the second case study I wanted to give you is very, very recently finished work. We're literally wrapping this study up, which is with climate affected youth in Kenya. Next. We've been working in 6 climate affected locations that you can see on this map. Kalobei is a refugee settlement in Turkana County, which is devastatingly being impacted by the drought in the Horn of Africa. If you do not know about the drought in the Horn of Africa, please learn about it. It's absolutely terrible. And Isiolo, which is nomadic and pastoralist community. Mathare, which is informal settlements in Nairobi. Naivasha, which is a flower farming community. Kilifi, which is an agricultural zone by the coast. And Kisumu, which is fishing communities. Next. So I'm not going to go into all of this in depth, just to say we did a lot of work. We did focus groups with elders. We did walk-along interviews with youth. We did participatory mapping, community dialogues, and those were all 10 to 14-year-olds in these communities. And then we very recently, like 2 weeks ago, wrapped up work with 15 to 24-year-olds that include SenseMaker, mixed methods interviews, and participatory video mapping, where we shared the findings from the whole study and young people made digital stories. Next. I'm just going to provide, for the sake of time, very high overview of findings. These are our findings. In essence, climate change across regions was linked among 10 to 14-year-olds with sexual and gender-based violence, HIV and STI exposure, adolescent pregnancy, and increased transactional sex. Next. And these varied across regions, but there were some consistent concerns, especially regarding sanitation conditions. And you can see in the informal settlements and the refugee camp, youth also were more likely to discuss sexual and reproductive health and rights. Next. And what we wanted to do in the final phase with the 15 to 24-year-olds was include groups who are completely overlooked in climate change research, such as LGBTQ youth, like lesbian, gay, bisexual, trans, and queer youth, and sex workers. And what we did was on the right, you'll see this piece of paper where sex workers actually brainstormed what was the impact of floods. You can see there's a lack of clients and money. There's a high risk of HIV, because when there's a lack of clients, it's harder to negotiate safer sex. So there's more condomless sex. Drought affects agriculture. People have no produce to sell in the market. There's no produce to sell. It can also increase sex work and sexual violence. High temperatures also destroy food. Excess winds can destroy venues where people are conducting sex work, can reduce security and increase exposure to rape. Those are some examples. And I just want to read to you the digital story created by sex workers in Nairobi, which talked about when there was a lack of rain, it led to drought. Drought made it hard to earn a living. People had to do sex for basic needs, including water. And, when you're having sex in exchange for water, it's very hard to negotiate safer sex. Next. And so tying this all back together, what does this have to do with self-care? Next. Well, I've made the point that extreme weather events can increase resource scarcities. This can lead to a lot of sexual and reproductive health outcomes, such as transactional sex, unplanned pregnancy, and reduced sexual relationship power. Next. And so if we do climate-informed sexual and reproductive health work, we can really think not just about food insecurity, but also water insecurity, what happens in times of extreme rain, and also how this does not affect everyone equally. There's gender and age differences. There's differences based on poverty and living condition. Next. And so these are the snapshot of our findings, which are hopefully coming out soon, but you can really see that on the left is pathways from extreme weather events to HIV and STIs through structural impacts such as damage to health systems, infrastructure, stockouts, the medication, healthcare provider are not necessarily ready for extreme weather events. There's also shortages of providers. There's community impacts such as migration, interpersonal impacts such as increased transactional sex, and individual impacts such as, people might not already have knowledge about HIV, and they might have to be in contexts where they're doing transactional sex. So next. So some key questions are, what is this range of climate change effects across regions, and how might self-care approaches mitigate the effects of climate change on sexual and reproductive health? Next. So this question is important, but it's understudied. So sexual and reproductive health preparedness for extreme weather events. What does that look like in the context of, for instance, early warning systems? How might early warning systems help with, for instance, if we look at this figure of self-care, self-management? So if we know that there's going to be migration, for instance, because there's going to be a drought, could we perhaps prepare people to have longer prescriptions of antiretroviral therapy, of PrEP, for self-testing if we know there's going to be disrupted HIV testing access? Can we provide HIV self-testing kits? These are just some very brief examples. And for self-awareness, if we know that, for instance, in our review, we found that in some contexts, extreme heat is linked with increased exposure to violence, how might raising self-awareness and community awareness about the increased risk of violence, or knowing that there's going to be elevated sexual exposures because of increased transactional sex, can we use somehow self-awareness around protective mechanisms in these times of climate change and extreme weather events? Next. And I just want to acknowledge, this is a QR code for our team's website. I want to acknowledge the incredible help and contributions and collaborations of our entire team in Uganda, Kenya, Toronto, funders, the artists who made the comics that you've seen, and thank you. And I'm at the perfect time of 14 minutes and 55 seconds.
Excellent. Thank you so much, Dr. Logie. As a reminder to our attendees, if you have questions for our presenters, please feel free to add them to the Jamboard linked in our meeting chat. And to answer the question in the chat, this presentation is being recorded and it will be shared after the webinar. Next up, we'll hear from Niall Nair. Niall is trained as a clinical geneticist, surgical researcher, and epidemiologist, and he is currently in his final year as a PhD candidate in nutritional epidemiology at Harvard T.H. Chan School of Public Health. Now, the stage is all yours.
Great, thank you. Good morning, and thank you for having me here today. As mentioned, my name is Niall Nair, and I'm an international PhD candidate from Fiji and a climate change ambassador at the Harvard T.H. Chan School for Public Health. I will be giving an overview of the Harvard and AmeriCare's collaborative efforts towards providing guidance to frontline clinics on dealing with climate change-related disasters. I will also provide some details from my own work, focusing on the nexus of climate justice, planetary health, and human nutrition. The Sea Change program is led by the Center for Climate, Health, and Global Environment, housed at the Harvard T.H. Chan School of Public Health here in Boston, Massachusetts. Our vision is a commitment to transforming science into meaningful actions that will deliver a healthier, more just, and sustainable world. Our mission is to deliver solution-based research and use education and outreach to shape climate actions that improve the health of most of our vulnerable populations, like children, seniors, and environmental justice communities. It is our hope that by making climate change personal, highlighting solutions, and emphasizing the important role that we all play in driving change, we can put health and equity at the center of climate actions. The risk pathways of climate change have increasingly threatened healthcare systems globally, and it impedes their ability to deliver safe, effective, and efficient care. Patients served at the forefront facilities typically encounter disproportionate climate change-related health burdens in every aspect of daily life. And although nobody is immune to the health threats of climate change, it is important to recognize that the historically underserved and at-risk groups, especially people of color, indigenous communities, and children and elderly, are disproportionately affected. As the Earth's average temperature continues to rise, natural catastrophes and extreme weather events will become more frequent and severe. Air and water pollution increasingly contaminate our environment, and the acceleration of climate-sensitive pathogens exacerbate the spread of infectious diseases. Extreme heat waves are already killing people all around the world, and this puts physicians on the forefront of dealing with the direct fallout of climate change in the clinic, at the hospital, in the exam rooms. We must be able to fortify our responses therein and treat the manifestations of these crises in our patients and work to prevent them from happening again. Some estimates forecast more than 1.2 billion people being displaced by 2050 to escape the catastrophic impacts of climate change. And it's not just the temperature either, it's floods, extreme storms, and forest fires driven by a changing climate that all lead directly to worse health in just about every way: infectious disease, non-communicable diseases, maternal mortality, mental health. And across the United States, thousands of community health centers and free clinics care for millions of the nation's uninsured and underinsured patients. Yet the worsening events from climate change threaten their ability to provide care and keep their patients healthy. The impetus for the Sea Change and AmeriCare's toolkit for frontline clinics began with a groundbreaking survey of more than 450 clinic staff from about 47 US states and territories. From the data, we learned that 81% of the clinic staff said their clinic experienced some sort of disruption due to extreme weather in the past 3 years. Fewer than 20% of the clinic staff felt that their clinic was resilient in the face of these extreme weather events, and more than 80% wanted education and training to protect their patients. And at least 77% said that they do not have the knowledge or tools to implement climate change preparedness at their clinics. We know of powerful solutions that can help reduce the harm from all of these different disruptions. And a first and less recognized solution is actually building stronger health systems and investing in the people who deliver care. So the Sea Change initiative aimed at creating a climate-ready healthcare workforce. The toolkit was created in collaboration with AmeriCare's to help protect people on the front lines of climate change. Biogen is our funding donor as part of their commitment to advancing climate, health, and equity. The toolkit's evidence-based approach offers resources for both clinical staff and administrators, providing actionable information that's actually based on the best available epidemiology and emergency management literature. And that way we have the versatility and resiliency to not only respond to the disruptions, but also protect essential services and focus on prevention. The toolkit includes clinical guidance and information on how to develop action plans and alert systems, tip sheets for patients, checklists for clinical staff, and so much more. The materials on extreme heat are dedicated to protecting patients with certain health conditions that require tailored guidance, such as asthma, cardiovascular disease, amongst others. Additionally, the disease management and action plans for patients and providers help prepare for other extreme events, such as wildfires, hurricanes, floods, as well as just general guidance to bolster long-term resiliency and sustainability planning. Now, our long-term goal is a world and a healthcare system in which we look at climate change and climate-related hazards as influencers of health and have the interventions that we can deploy to keep people safe or to strengthen their ability to self-care for them to be able to care for themselves. And I believe that the concept of self-care is complementary and central to the concept of prevention in health. Self-care interventions for health thus have to be a complement to health services, and they also have to be sufficiently flexible to allow patients to have the agency to meet their range of needs. Now, these links to the health system are critical so that the patient can seek services whenever they need it. And these different service points through which self-care interventions can be provided, example, a healthcare facility, pharmacy, a community health worker, or even online, all of these influence the ability, accessibility, acceptability, and ultimately the uptake of these measures. The Climate Resiliency Toolkit aims to bridge the gap between awareness of climate change and the impacts and ability to self-care and respond effectively through a series of digital fact sheets for healthcare providers, patients, and administrators. It offers practical, concrete measures that can be implemented in dire times. Now, the toolkit is very comprehensive and it covers responses from a wide range of perspectives, from care providers, from the patient's perspective to self-care, and from clinical administrators. I'll cover a few of these disasters from these various perspectives, and more information can be found online. Now, in the patient-directed fact sheet on heat-related emergencies, the toolkit advises individuals to avoid sugary drinks, alcohol, and caffeine. To monitor the color of their urine, we actually provide an infographic on the different gradations and what they actually mean. All of these are very concrete, straightforward things we can do to try to get a leg up and staying out of harm's way when climate shocks happen. It also helps patients understand potential enhanced risks of certain medications and to discuss with their care providers in times of climate-mediated crises. Additionally, there's information on community cooling centers or how to practice effective cooling techniques at home or in low resource settings. We also include infographics on how to spot signs of heat exhaustion or heat stroke and what responses would be warranted. In the provider-directed response sheet on flooding information, providers get general information on how to best advocate for their patients, as well as specific populations that might need special attention. Now, there's a wide range of adverse health outcomes with flooding, but the immediate health risks include common yet unintentional injuries such as drowning, electrocution, cuts, lacerations, puncture wounds. Flooding has also been found to increase the risks of infections, including vector and rodent and waterborne diseases. Providers are also asked to flag patients that might have increased risk, including Black and Hispanic patients, those with chronic diseases, disabilities, as well as rescue workers and first responders who are at the forefront in aiding people. It also gives concrete guidance to patients on how to come up with action plans in the event of flooding. Finally, as wildfires become more frequent due to climate change and drier conditions, more of our communities are at risk or at harm. Patients as well as communities affected by wildfires can execute both preemptive as well as real-time measures to ensure their safety. For areas prone to wildfires, the toolkit details how best to prepare, including emergency kits for patients, communications sent by the clinic administrators to warn patients of impending risks, as well as the status of the clinic if they're accepting patients. It also details for patients how best to monitor risks and best practices to mitigate indoor particulate matter and smoke. There's actually a series of steps with infographics on how to create indoor filters using a box fan. Those most at risk from wildfire smoke include children, older adults, outdoor workers, and anyone who is pregnant or has heart and lung conditions. Those with chronic conditions are asked to speak to their care providers about how smoke might affect them and what symptoms might warrant immediate attention. And for the community, we also provide information on how to create defensible spaces to act as a buffer to slow down the spread of fire. We're currently focused on resource sharing nationwide, inclusive of creating clinician screening checklists for assessing patient vulnerability, as well as disease management plans for patients and providers. Efforts are currently underway to expand the toolkit to low and middle income countries with country and context specific considerations. We're currently working to introduce the toolkit in the Philippines. Shifting gears a little bit, I wanted to also take the time to discuss really briefly some efforts regarding nutrition security. I believe that this is especially warranted in this forum, given that global food systems are contributing to a majority of the greenhouse gas emissions. Now, with climate change, it's actually beginning to reverse years of progress in combating food and water insecurity that disproportionately affects the most underserved populations. So food insecurity from rising levels of carbon dioxide is actually leading to decreased levels of proteins, micronutrients, and other vitamins of staple crops like rice and wheat. And this in turn is leading to undernutrition and stunted childhood growth and vulnerability to non-communicable diseases. As Dr. Logie had mentioned, there is a growing body of evidence suggesting that food insecurity in many settings is likely to disproportionately burden women and girls, who are more likely to suffer from mental illness or partner violence following extreme weather events. Climate change is also likely to impact pregnancy and maternal health outcomes directly, either through the changing weather patterns or indirectly because of the stress associated with the changing weather patterns. There are several reviews of literature linking adverse weather and with adverse pregnancy outcomes, increased infectious disease, dengue fever, malaria, and that increases the risk of miscarriages, of premature births, of anemia. Moreover, saltwater intrusion into groundwater is causing, which is more likely with higher sea levels, is associated with increases in rates of preeclampsia and hypertension during pregnancy. Now, our efforts at combating climate change has largely focused on the vastly popular concept of climate change mitigation, where approximately 90% of our funding is usually directed. And these include our efforts at decarbonization, divestments from fossil fuels, or investments into renewable energy. And while these efforts are great, it will take decades to decarbonize the world's energy supply. And meanwhile, all the carbon we've emitted and keep emitting will continue to warm the atmosphere for hundreds of years. So the money spent to mitigate emissions will pay off in the long term, but they do little to protect a country, especially in the global south, from climate change right now. So in terms of self-care, I wanted to focus our efforts on fighting climate change through the concept of adaptation. Climate change is a present event. So solving it also means addressing the problem as it exists today. And some of these might include adopting healthier and more sustainable diets that focus on plant-based foods and reducing the consumption of animal-based products, which is not only good for the environment, but also for human health. Climate change and nutrition need to have an aligned agenda that needs to be acknowledged by national policies. We know that crop prices will increase, and we also know that food quality will continue to be affected. In the US, policy implementations could also include strengthening sustainability guidelines of existing nutrition relief programs, such as the SNAP program or the Women, Infants, and Children Supplemental Nutrition Program, WIC. Thirdly, and more importantly, empowerment of women should be seen as a key intervention to address climate change. Women farmers often use agroecological type of farming, which involve climate-smart practices. And additionally, it's important to remember the value of indigenous knowledge related to climate change adaptation, This includes identification of underutilized plant varieties, as well as varieties that might have higher micronutrient value or could be grown at higher altitudes due to the changing climate. Now, the last point I wanted to touch on regarding nutrition is the rather nascent approach to climate adaptation, which aims to help vulnerable populations by giving them just-in-time cash transfers. That is, free money, no strings attached, and the recipients can use to improve their resilience in days or weeks before climate change-induced calamities strike. This lowest hanging fruit is actually giving people the agency to make the decisions most pertinent to them in their specific context. Research on poverty alleviation has demonstrated how impactful these cash transfers can be. And so it seems that cash transfers for nutrition in the face of climate change may be context specific. There is mixed results. However, it has highlighted that these cash infusions have protected communities from food insecurity and damages to their livelihoods from the worst impacts of disasters such as droughts in Malawi or severe floodings and storms in Bangladesh. Additionally, these vulnerable communities are able to protect important agricultural assets, and we've seen farmers using better seeds that are drought and flood resistant. So these are just a few things that can be strengthened as we look towards resiliency through adaptation in a world that needs solutions now, because climate change is something we're all living with. And thank you.
That was excellent. Now, thank you so much. Finally, we'll hear from Rafia Rupp. Rafia is working at the White Ribbon Alliance Pakistan chapter as national coordinator. In this capacity, she not only oversees the implementation of various projects undertaken by the organization, but also leads the team as the national secretariat. Rafia, the stage is all yours.
Thank you, Nicole. Okay, I'm basically here to present and to share with you the findings of a research work that has been undertaken. Now, it has been a collaborative venture undertaken by White Ribbon Alliance and Human Rights Watch. And it is basically focused on exploring the intersecting link between extreme heat and maternal health. Now, before I start sharing the findings of the research with you, I first want to talk about a little bit as to why did we even do this research? How did we actually get into this? And for that, I kind of have to go a little bit back in time. Next slide, please. So this is sometime in 2018, 2019, when White Ribbon Alliance undertook this global advocacy campaign called What Women Want. I'm sure most of you here must have heard about it. The idea of this campaign was to actually find out from women their key reproductive health asks. Now, under this campaign, we went to different women across the world, actually, and we asked them only one single question. What is your key ask regarding your reproductive health? Around the world, we reached out to around 1.2 million women. In Pakistan alone, we reached out to around 250,000 women. Now, when the responses started coming, they were kind of like quite predictable, like women were asking for better health facilities or more qualified doctors or free medicines. But then there were responses which initially did not make any sense to us. Next slide, please. Like, for instance, women are asking us about, tree plantation or about, fans or solar panels. And, initially we thought that maybe we were asking them the wrong question. Anyway, but then we decided to do a deeper dive into these, responses. And we found out that responses of this sort were actually coming from those areas of Pakistan which were experiencing extreme heat over the years. And over the years, we could see an increase in the intensity and frequency of heat waves. Now, I say this always at every forum, and I'm going to say it over here as well. All these women actually do not know the climate change terminology, but they were all actually telling us about the climate change reality that they were experiencing on a daily basis. So we thought that it is high time we find out exactly what are the challenges being posed by extreme heat to the reproductive health. And this is actually what led to this research. Now, next slide, please. Now, we know, and next slide, please. Okay, we know, and like my colleagues earlier have spoken about it, but there's a very clear and distinct link between extreme heat and the challenges it poses to pregnancy health and fetal development. Now, we know about preterm birth and still births and about hypertensive disorders and, other issues that take place because of extreme heat during this time. However, the issue is that have we even ever tried to find out how the women themselves are experiencing this? Is this really a challenge for them? And if it is, how are they navigating? What are the remedies they're using? and what kind of interventions are they looking for which would help them address this challenge. So basically, the next slide, please. So basically, this is what became the focus of our research, to explore the personal dimensions of how to manage extreme heat, like to see how women are doing that and how we can assist them at one time in addressing this challenge. Next slide, please. This is a quick overview of the research methodology that we undertook. It was a qualitative research. It was very in-depth. So for that, basically, we obviously, initially, we always have those desk reviews and literature reviews, and we developed some tools, and you have to go through the periphery of whole ethical approvals. And then we interviewed women. We interviewed 16 women. We focused on the province of Sindh. And in Sindh, we focused on that area which is known to have a very high temperature during summers, that is the district Shikarpur. And over the years, this has been experiencing an increased frequency of heat waves. So we interviewed women, pregnant as well as lactating, and we went to some healthcare providers and some government officials as well. Now, next slide, please. Now in the coming slides, I'll be sharing with you the findings of this research. And unlike my previous colleagues, I won't be showing you any diagrams or like any graphs or charts or anything like that. Rather, I'll be using the voices of these women to bring to you their experience of heat waves. Next slide, please. So basically, when we spoke to women, certain things were actually reported consistently across all the interviews. All women actually spoke to us about feeling some, dehydration, nausea, vomiting, and severe headaches throughout. Pregnancy is a difficult time, no doubt about that, but extreme heat was adding to it. Pregnant women do feel nausea and vomiting in the initial, period, but feeling that throughout that time, and especially more so when you're pregnant in those like months when the heat waves are going on, that is a persistent thing which came out in the interviews. Then, heat waves actually compound existing vulnerabilities. The quote that I've given over here is from a woman who had hepatitis C. However, there are other women who were pregnant and who had other health-related challenges, and heat waves and the experience of going through it actually added to that problem. They made the situation worse. Then the burden of care got worse. A woman is pregnant, and as is generally the case, whenever someone else in the family falls in, even if the woman is pregnant, she ultimately has to take care of that person. Now, because of heat waves, other people in the family also get ill. And so ultimately, she's the one responsible for taking care of them in spite of her condition. Next slide, please. Okay, the economic consequences. In Pakistan, 60% of the population is associated with agriculture, either directly or indirectly. Now, when there are heat waves or extreme heat, it leads to obviously shortage of water, unavailability of water, and we have droughts, which obviously has straight consequences for their livelihood. Another area, you see, women work, and you just cannot take a day off if the weather is hot. So and obviously you know that in rural areas, women have to go and work in fields as well. And then there's subsistence farming in which they're involved in. They're taking care of livestock. Now they can't take time off from all this work. So basically what we're doing is we are asking them to choose. Either you work, or when you get a chance of having a heat stroke, or you stay at home and your livelihood goes. So it's a choice between life and livelihood. Next slide. Okay, as I mentioned earlier, women are involved in a lot of work. Of course, first of all, our household chores. Like women, obviously, in our area, like rural areas, have to cook food, and they have to cook food in the open areas, and they have to use firewood. It's really hot. And as one woman pointed out, and I've quoted it as well, that that she wished that she could stop cooking. That's the best way of staying cool. But who will cook the food then? She's the one who has to do this. Then women are involved in subsistence farming and taking care of livestock. Now, this is grueling work in heat. Then transportation of water. Most of the areas don't have water. So obviously these women have to travel to get water. Now, when there is increased heat, the woman herself is drinking more water, and so is everyone else in the family. So your trips for getting water increase. Now, in some other cases, we saw that the houses had a hand pump inside. But generally what we saw is that this hand pump was not covered. It wasn't under any kind of shelter. So women have to stand in the grueling heat and then, pump the water. Then childcare. Childcare ultimately is a woman's job, no matter where you are actually. And what women reported to us, that all the tension that they were experiencing, there's the heat, there's the worry about the economic, side of things, their livelihood, the taking care of the household in spite of all the heat. And then what happens, all this frustration, all this anger, it comes out on their children. Women reported hitting their children and then feeling guilty afterwards. That's natural. But then the damage is done to the child's psyche and to the environment of the home. Next slide. Okay, the experience of pregnancy. Generally, pregnancy is supposed to be, a really beautiful time in your life, but the heat made it miserable, literally. A lot of women actually said that, I wish we could change this time, I wish we could, we wish we could get pregnant during winters. So that was a very interesting, choice for us. Like, we never expected that, actually. Then worries about fetal development. A lot of women felt that during heat waves, the babies were not moving, fetus was not moving, and that really added to their worries. Breastfeeding, another area of concern. In Pakistan, the rate of breastfeeding is quite low as it is. No, but then you add this heat factor to it. How do you add it? Let me just elaborate that. First of all, when it's really hot, you don't feel like eating. The same thing stands true for pregnant women. They don't feel like eating. Now that means that their nutrition is compromised. And when that is compromised, that moves on directly to the child which they're breastfeeding. Another thing, these rural areas face power outages. These power outages are like somewhere between 12 to 14 hours every day. So what do? Well, they use these solar panels. Solar panels are expensive. So they use a very basic solar unit, which means it runs during the day, but there is no battery storage, so it does not run at night. So at night, they have these handheld fans. Now imagine it's so hot. Either you hold a fan or otherwise you just kind of sleep. So the sleep is really compromised because of the heat. And because of that, they don't feel like feeding the baby as well. So, one thing leads to other. Next slide, please. Okay, mental health. This is another issue which came forward. The women that we spoke to actually reported feeling this pervasive feeling of unhappiness because of so many factors. Obviously the heat is there, but then poor sleep because of heat, poor nutrition because of heat. When you have to work in high temperatures, you're not in a good mood as it is. Then you're worried about, the economic consequences, your livelihood. You're worried about your fetus who's not moving, and you're worried about your other children who are running around and also getting ill in all this heat. And all this, there's a constant feeling of despair and anxiety. And then since women reported again that this year was hot, but last year was hot, but this year was even hotter. So they can feel it getting worse over a period of time. And that makes them worry about the future for themselves as well as for their children. Next slide. So then we asked them, after all this, okay, so how are you managing? What are you doing things? Well, obviously, frequent bathing in cold water. How frequent? Well, 5 to 7 times in a day. And actually, this goes for everybody in the house. Then obviously, as I mentioned, they use solar panels. They have these handmade straw fans, which they use. They sleep in courtyards at nighttime, not very pleasant, honestly. And then interestingly, they said that we distract ourselves. How do you distract yourself? Well, they say we get busy in household chores, just take our mind off things. Or they go and visit their neighbors and they gossip. I really like that, actually. And they said that they go to the local schools once the school is over, and then they kind of just spend time there in the peace and quiet. A lot of women said that, we just go there alone. We just want to be alone over there for some time, not think about all the other worries that, that are just around us. So that was interesting. Next slide, please. So then we asked them, okay, tell us, what do you think needs to be done? What interventions come to your mind? Well, pretty basic. Obviously, they wanted to have a steady supply of electricity, and if not that, then they wanted to have, solar panels, which you purchase easily, which are not very expensive. Okay, they emphasize on getting information. You see, in our country, during heat waves, we have all these campaigns on radio and television in which they talk about how to handle, what to do, but those are very generic. They wanted to know specifically what a pregnant woman should do during heat, what a woman should do who's lactating. They wanted very specific direct messages. Then they wanted access to cooling spaces. They found one, the schools, but they also wanted other places as well. Because obviously men have more mobility. They can have far more choices. Women don't. And then interestingly, they highlighted a tradition. There's a tradition called chilla. It is observed in the rural areas of Sindh and also in certain other areas of Pakistan. Now, the idea is that once a woman gives birth, her body should stay warm. But, traditions, as you know, they kind of take things to the extreme. So in chilla, a woman after giving birth is not allowed, by her elders, in-laws and everyone, and her husband as well, to not take a shower or bath with cold water for 40 days. Now, or you're not even to drink cold water. Now, imagine just before this, just before delivery, when you're pregnant, you're taking 5 to 7 times, like, showers in a day, you're drinking cold water, you have a child, and now just, okay, fine, you can drink water, but it has to be lukewarm. You can take a shower, but warm water, imagine. I mean, so this is one tradition that was identified. I'm sure there are others as well, which are, further creating problems for these women. Next slide. So now, after going through all this, what are our recommendations? Next slide, please. Some of them are like pretty tangible, direct, and they were focused exactly on how to increase access to cooling. One I'm sure you know about is to provide cash transfers, so that when there's heat wave, women can take some time off and they don't have to choose between their health and their livelihood. They can just relax for some time. Obviously, we can assist them by helping them in having infrastructure which helps to keep cool houses, like they can have those you can paint services, you can have special roof tiles and things like that. Then very specific and focused awareness and information campaigns to tell them exactly what to do, how to avoid heat, how to address these challenges when you're pregnant or when you're lactating. And then obviously creating some cool spaces, where they can just go, just talk to each other, relax, enjoy some cool time, away from all the heat. So those are simple things. Next slide. Then there's some higher level things, like we're looking at integrating extreme heat into maternal health services. How do we want to do that? First of all, I'm saying all these things from the perspective of Pakistan, but I'm sure that other countries can also kind of adopt it or adapt it in some way. In Pakistan, a lot of work is being done on climate change and obviously on extreme heat as well, and other climate-related disasters as well. So we want to better understand what is the work that is going on, what is happening, so they kind of just collate and see where we can collaborate, how we can work together for this. Then another thing is, as I mentioned earlier, this link between extreme heat and maternal and newborn health. While it's there, it has to be brought forward in the forefront for the government as well as for the development partners. And that can be done through a variety of means, like through trainings, meetings, conferences, but this is important. This link has to be created and it has to be emphasized. In Pakistan, lady health workers are the frontline community workers. They are the ones who interact with the community on a daily basis, literally. They are the best people to inform, educate, and make these women aware about the challenges and how to address the challenges. So that's another thing. Then positioning self-care as the first line of defense in terms of not just empowering women to make choices about when to get pregnant and what to do, but also to prevent them from facing this increasing climate crisis caused not just by extreme heat, but by others as well. And finally, and most importantly, to ensure that maternal and newborn health is fully included in the climate adaptation policies and planning. In Pakistan, we have a climate change policy. We have a national climate adaptation plan. In Sindh, where we conducted this study, just last year, they have approved the climate change policy. Interestingly, in all these documents, there is a big mention of health in general, no mention of reproductive health. I'm not saying this that people over here don't care. I'm saying it's not on their radar. This connection has not been made. And that's what actually research studies like this aim to do, bring things to the forefront. Tell them this is a link, be aware, and let's do something about it. So this is like, this study has actually been done with exactly this point in mind. I've taken, I think, a little more than 15 minutes. So I'm going to stop now. This was just a brief presentation, but there's a link in the chat to the research study. Please do go over it. I'm sure you will enjoy reading it. Thank you.
Wow. Thank you so much, Rafia. That was amazing, as well as Niall and Dr. Logie for all of your thoughtful and deeply insightful presentations. I want to open the floor for our roundtable now on self-care and climate resilience. As a reminder, I'll be prompting some themes along the way for us to discuss, but you can also submit questions via the Jamboard link that's been shared in the chat. Alternatively, you can raise your hand in the Zoom box and I will call on you and you can unmute yourself to join the chat to contribute or ask your question. Again, we want this to be an open forum and a conversation. So first, I actually want to start with one of the questions in the Jamboard for Rafia, because your presentation's recent, amazing work. Can you speak more about the temperatures you witnessed in your work in Pakistan, and if there's any predictions for the future that you had looked at? So if there's a one 1 degree increase, then what will happen? Did you look at any of that?
Okay, the area that I'm speaking to you about, this is District Shikarpur. It generally experiences during the summer season, and by that I mean basically from June till August, somewhere between 40 to 45. It has been known during heat waves to go above 45 as well, 40 degrees Celsius. Now, I'm not exactly sure about what will happen if there's an increase of like 1 degree, but I'll just give you a general perception, general idea. Last year during COP, UNDP published a report, and it was presented over there, and it was about these changes in temperature, and there was a part in it about Pakistan. According to that report, by 2050, in Pakistan there will be no season of spring. We'll be moving straight from winters to summers. So you can imagine how the temperature will rise and what great challenges it will create as we move forward. So we are looking at actually increased periods of extreme heat and increased heat waves as well, increased frequency and intensity of heat waves, and the challenges obviously it poses.
That was great. Thank you. Nyla, I want to move to a question in the Jamboard for you. Apart from the Philippines, are you planning to adapt your toolkit or test it in other countries in Africa?
Yeah, okay, interesting. We have received some funding from Johnson & Johnson to start the work internationally. And the first country we are working in, again, in partnership with AmeriCares, is the Philippines. I'm not high up in the command chain to be able to actually decipher where the next intervention might be, but it is currently being piloted. We only did launch it last year. It's being piloted in 19 clinics along both coasts of the US. And these are to hurricane, wildfire, and flooding prone areas. And we have seen feedback from these clinics that have been wildly positive, especially in San Jose, in Houston, Texas, which serves an entirely uninsured population.
That's great. Yeah,
There-
go ahead.
Sorry. There is Elena Ativa, who is the director of AmeriCare's Disaster and Resiliency program, who is on the call, and I'm not sure if she might have some more insight.
Can
Oh,
I
she
be-
was on the call. I see she's not here anymore.
Yeah, one of the other questions in the chat was, do you have any case studies for the communities that this toolkit has been successful in? So I think that's helpful and something we'll definitely have to look into.
Right, yeah, it is a pilot program, and we are touching base with these clinics to collect data.
That's awesome. One other question for you, or there's two, but one that kind of tees off of that is if you have any insight into what resources, money, timing, or planning would be required to implement the toolkit in local communities. Have you received any feedback on that?
So it is, again, relatively, it's adaptable and can be scaled. It's literally interventions allowing us to understand from the care provider's point of view what to look out for. So it gives that sort of information, and it can be adapted in any context because these are all medical conditions that we could be aware of and are aware of. The only thing and it is, again, available in English and Spanish, so it can be adapted to these countries that have these as major languages. The only thing that I would be careful about in the implementation is we have an aspect that I am trying to sort of untangle in my own research is climate fatigue and mental health of the care providers. And in low resource settings, if we're not able to adapt these guidelines for their specific climate related disaster, for example, right now we don't have guidance on drought. And that's what majority of the African or continental African countries might be facing. We don't have advice for that. And so climate fatigue and mental health of our care providers might be endangered if there is misalignment of the toolkit as it gets adapted in those situations.
Wow, that's super insightful. Thanks, Niall. I want to bring two questions to the forefront for Dr. Logie, if that's okay, in the Jamboard. Thank you for your presentation. Excellent research and echoed many times in the chat. If there's one thing you could suggest from your research to help facilitate a catch-all solution, what do you think that would be? That's a tough one.
Always centering equity and and making sure that climate change research doesn't reproduce exclusion of most marginalized people. So in the climate change research to date, I've seen nothing on sex workers, and they actually had so much to share that was really unique and valuable. I see nothing on LGBTQ folks and SRH, and I didn't have time to share it today, but we talked with young gay, bisexual, sexually diverse men in Kenya, and all these problems are interlocking. And so, I mean, this is more than one thing, but like an intersectional approach would also look at how some people have extra vulnerabilities that are produced in society. So when you have contexts of criminalization, which are, of course, a legacy of colonization, those contexts of criminalization reduce people's opportunity to live life to their full potential and realize their potential, and also produce contexts where people are not safe where they're living. And so we had a lot of narratives from, for instance, young sexually diverse men who didn't have a place to live and were sort of like living outside, moving place to place. And actually, what do we know about their needs when it comes to extreme heat, when it comes to drought, when it comes to extreme rain? The informal settlements we work in, the people who live right close to the creek and the river are the ones who are going to get flooded and have to move. And so it's always thinking about who is not included in our work, who is missing, whose voices are missing. Those are the people who probably most need us to go out of the way and include people. In all the systematic reviews, they come to the end. The limitations of this are we're not including the key populations most affected by HIV in this review of drought and HIV treatment adherence. We're just working in silos, and we just need to call out and when we see like the dominant exclusions that happen in the climate change work, or maybe call in somehow we just need to make sure that we're not reproducing climate change research that excludes LGBTQ people, that excludes sex workers, that excludes the most poor folks, so that it's not just climate change research for the people that's easy for us to reach.
That's great. That's a great answer. And I think Martha in the chat makes a great point too, that there really is no catch-all solution to all of this. And I also want to bring Sally's point to the forefront too, that centering the voices and leadership of those most affected and promoting locally led and Indigenous solutions and adaptations is fundamental. Yeah, and we saw that with Niall's work too. So I think there's a lot of synergies in like self-care and climate across the board there. So really excellent. I want to give someone in the chat and the Jamboard room to maybe expand on this. So if you want to come off of mute, you can. Napone, apologies if I'm saying that incorrectly. You asked, what can you do to help our African populations increase their resilience to climate change? So I think that's more of a broad question, but I want to make sure that I'm covering that effectively so you get the answer that you want here. Or if not, if any of our presenters would like to jump in on that.
Okay, I can just give it a go. Okay, Nicole, actually, I'm going to echo this conversation, first of all, which is going on, and I just want to lead to that to answer the question. I'll be speaking from the point of view of reproductive health, obviously, since that was the focus of our research. It is very important to involve those who are most affected by climate change. In our particular case, it's the pregnant women and lactating women, obviously, those mothers, who can speak on behalf of their newborn babies. there's so much work going on at the policy level. But those policies, those decisions need to be informed by the voices of these women. Whenever we are talking about informing decision makers, we end up talking about, like hardcore research. But of course, that's very important. That's hardcore evidence. But women live experiences, their voices, what they are experiences, that is also very important. Now, that will help to actually bring forward what exactly the challenges are. That's one. Secondly, these women are going through a certain thing on a daily basis, and they're not just sitting there, they're finding out some mechanism, some way of addressing it. They have their own solutions. Those need to be identified, and those need to be brought to the forefront from that. I'm not saying like we should not think on our own and try to bring up some such interventions as well, but let's start from listening to them. Let's start from listening to women's voices and seeing how that can inform the process. We are doing that in Pakistan, I'm sure in other countries, even in Africa. They can think about, first of all, involving those who are most affected, listening to them, how the challenges are, what the challenges are, and how they can be addressed. So I think that would really speak to the problems on the ground. That's my take on it.
That's great. A lot of locally led research there. Now you came off mute, so I want to make sure you have a chance to speak too.
Yeah, I want to speak to that in terms of nutrition and food security, and especially nutrition security. So I think there is avenues to adapt and scale up some of these programs that do exist in the African continent. The World Food the World Food Program has tried the anticipatory cash transfers in Somalia and Ethiopia with positive results. These cash infusions have protected communities from food insecurity. Niger has kicked off its own anticipatory cash transfer that they actually want to be unconditional cash transfers. So there's this nonprofit, Give Directly, that really is a big champion of unconditional cash transfers. And they launched a climate adaptation program in Malawi last year. And they sort of simultaneously worked with another group called United Purpose. And they didn't tell the farmers that they were doing this, but they worked with the same group of farmers, one giving them cash transfer and another giving them training on climate resiliency in terms of smart agriculture, in terms of what to do with your stockpiles, just how to move your animals. And what they saw was when they actually gave those farmers those payouts in anticipation of the wet season, the farmers were not only better secured, but there's actually a 60% drop in participants who would have experienced nutrition insecurity otherwise. So there are these programs that do exist. It's just I don't actually know who to direct this to, and this has been the biggest challenge in terms of where do we get that funding from and who is funding what? Because it seems like, again, 90% of that funding bucket is being challenged and channeled into mitigation, which is not giving us results right now. And we need to focus on adaptation in these countries that are living with these daily challenges.
Yeah, that's super important. Sally, if you want to speak more about your research that you commented on in the chat, I think that would be a helpful tie back to this conversation. So if you want to come off mute, please feel free to. I'll give you a moment.
Sure. Hi, thanks everyone. This is Sally. I'm a senior researcher at IPASS and have been doing research on the intersection of reproductive justice and climate crisis for the past 4 years. And so this was our first study that I put in the chat where we were just starting to explore this. And I just wanted to highlight the five solutions that women brainstormed across the two countries and various study communities. And they were, one moment, increase women's opportunities for paid work so they don't have to resort to jobs that risk their health and safety. Consider women's needs when building spaces for shelter and resettlement during and after climate disasters. Improve access to healthcare, particularly SRH, that is resilient to a changing climate. Invest in women's and girls' education and reproductive autonomy to give them more power over their lives and decisions. And finally, involve people most affected by climate change, including women and youth, to develop and lead climate action efforts that include reproductive health. And we have quite a bit more research underway from Indonesia, Nepal, Northern Kenya, Bolivia, and Ethiopia, where we're doing similarly participatory research. And hopefully we'll be able to share soon some more solutions.
That's
I
so
just
awesome.
wanted to say, I appreciate you mentioning one of your recommendations, which is listening to youth, which is what our project focused on, and especially the 10 to 14-year-olds. We know we're not up to 24, but the 10 to 14-year-olds had a lot of recommendations for their communities, for the governments, for the world. So I think amplifying their voices is a great recommendation.
Yeah, thank you, Carmen. And we were able to include women under 18 years old in both countries in our sample. So that was also great to see the wide range of people's experiences and ideas.
Excellent. Thank you, Sally. Martha has a question. So Martha, if you want to unmute yourself to follow.
Hi, thank you very much. And thanks to the presenters. Brilliant, everyone. So, hats off there. And I'm hoping that we'll get all the various, links to the research and whatever afterwards. That would be great. So thank you all. A couple things from all of you that just really struck me as one is the importance of including those who are most affected in the discovery and understanding about, and also actually in proposing solutions. I work a lot in designing adolescent girls programs, and we've done a lot of research and asked them what they want, and then actually engaging them in proposed solutions is actually another important step, right? But the one thing I wanted to ask, and maybe it's to Niles or to all, when I think of sort of basically people living with compounded vulnerabilities, essentially, is what we have in many ways, right? And so is there any, I dare say, predictive model where we know from weather and climate related predictions and compounded vulnerabilities that people live under, right? So we can triangulate that data to then feed into what I think, Carmen, you mentioned this early preparedness stages, right? So what are we going to do with that now, right? And how do we do that? And I know I work a bit in sort of some work on adolescent sexual reproductive in refugee settings, and sort of the pre-positioning of products, et cetera, to get them to a place where people can then have access if we know these changes are coming or whatever. And I'm curious about can we two things? One, can you link sort of climate related data and vulnerability data such that it is in a way to build that picture? And then how does that link to preparedness and early responsiveness in kind of government or programming? Just sorry if that was a confusing question, but I see some nodding, so I think you get it. And also just one last thing. I have worked in cash transfers. They actually do work and in many settings. So I'm all for that. Okay, thank you so much. I'll turn myself off.
I would just say that there is evidence. There's been systematic reviews in Lancet Planetary Health on the extreme weather events and gender-based violence, on drought and HIV treatment adherence. There is data that shows that that climate change is linked with these. The challenge is they don't cover every weather event, every sexual and reproductive health issue, and every global region. So you have a lot of it actually produced in the United States, but not, on extreme heat, but not necessarily in other places. Or the extreme heat might be looking at, like some sort of child health outcome, but not SRH. So there is data, and then there are also knowledge gaps. But I do feel like the early warning systems could be better equipped. I haven't really seen that. There's been more so with regards to gender-based violence. So, if a storm is coming, they send out some sort of warning about gender-based violence prevention. So that's where I've seen it, but that's in 2 different regions from our scoping review. So the data is there, and there's a lot of gaps in it, which is what I would say.
I want to add on to that. I think that's a really good point to make. Part of my work also does look at big data and predictive modeling using AI and machine learning to do these things. The one thing that I have found as being something that impedes my ability to do that is as Carmen has mentioned, a lot of the data that we have and a lot of the work that we do exists disparately in silos. And so not having the connections between the health data, especially in the US context where it's all private, everything is different. It's not a national system where everything is being input at the same time. It kind of impedes the ability to teach these models how and what to pull out. So while we can do predictive modeling for, let's say, using satellite data on water scarcity that might occur due to a drought that's upcoming, and we can disseminate that information to a community that is affected. This has been done before. Smartphones are almost everywhere in the global south, which is kind of funny to me. It's underutilized, but combining that with health data is a challenge. I am trying to do something in Fiji. It's super sad that, you know, a country that is known for its water is experiencing lack of it in maritime and rural communities. We don't have access to safe drinking water. So a couple of us have created the South Pacific Foundation in Fiji that is trying to use indigenous knowledge, local resources to create water filter systems using natural aquifers to deliver water safely to these communities, but also have the community as shepherds of these systems, and using technology to not only access any problems, but also disseminate issues that might be upcoming with them. So on these one-on-one bases, we do have that ability to create these models, but on a national level, on a country level, on maybe a community level, it all comes down to where the data is coming from, how clean is the data, does the data include these vulnerable populations? Are the marginalized also included? Are those disenfranchised from medical health care and equity included in the conversation in the data itself? So just, again, knowledge gaps, don't know who to turn to for funding because everybody wants to do mitigation versus adaptation. Frustrating, but a really good point, Martha.
Yeah, I think we can see that across the board. Martha, hopefully that answers your question, or if you have any follow-ups, please feel free to chime in.
Yeah, no, thank you. I have many more thoughts, but I won't be quiet now. This is really great. And the work you guys are doing is just really, really super. Thank you.
Excellent. We only have a few more moments, so I want to take time to ask all of our presenters to answer this question. It's important that we leave, I think, on a high note here. So I want to understand what's next for all of our presenters. What can we look forward to, and how specifically are you maintaining hope in all of this very complex research and nuanced research? So I don't know who wants to start here, but feel free to jump in.
Okay, I can go first. Okay, actually, as mentioned in my presentation, we are actually, the last point which I mentioned, the last but not the least, that is of integrating maternal and newborn health into climate adaptation planning. That's what we're focusing on. So as the study was done in Sindh, our next step, that's what we're focusing on. We're now interacting with the concerned provincial government, and we're looking at the that obviously once a policy is made, different implementation plans, action frameworks, adaptation plans are made. So we are in conversation with them. We are taking this research to them, and the idea is that whenever the adaptation plans are made, maternal and newborn health are incorporated in that. And we also are trying to ensure that this process of including that is informed, actually is continually informed by women's lived experiences, by their voices, and by their perspectives of this challenge and how they're addressing it. So that's the next step for us.
Excellent. Carmen, Niall?
I think what's giving me hope is, or even like the scaling of the next steps with AmeriCares and how we're trying to deliver these toolkits to other countries. But there is a growing movement in integrating climate awareness in healthcare delivery, and this has started at Harvard. We have a Climate MD program where we are realizing that a lot of these existing conditions and comorbidities are being exacerbated with the changing climate. We are pushing for research and looking at how current care might get complicated. What are the pharmacokinetics of drug delivery and how that might change? And to Carmen's point, although I'd love to see this shift a little bit, but the youth movement and youth empowerment with climate change is something that is also really heartening to see. I am working with the European Union's youth program on climate change, and that we did a great seminar with them and included some participants from the Middle East and North African regions. But again, it was mostly an EU-based community that was looking at solutions of integrating youth voices in climate movements. And hopefully we can get more of the global south that are being directly impacted by climate change. My lived reality was climate change. It still is. And for a lot of us, we are the ones pushing the envelope in trying to get the global north to be more accountable, and including the voices of these disenfranchised youth from the global south would be a great movement to see.
Agree. Go ahead, Carmen.
I'll say 2 examples was from the research I shared in Kenya. We created songs like with the youth, each youth group, where they came up with what they wanted to see happen in their communities, and we shared their, the last stage of sharing what they shared in participatory mapping and qualitative in the recommendations with communities. And after sharing in Isiolo, a lot of the stress that young people were under was because of the situation of the toilets not being safe, secure, a lot of challenges, toilets. They actually built 5 new toilets in the community. We never asked them to, the young people shared their recommendations, and 5 more toilets were built, which that was pretty awesome. And in Mathare and in Nairobi, when the youth presented back their recommendations, they started a community climate group, and with a specific focus on actually how to help young people and all ages dispose of menstruation hygiene management products in a shared toilet space. And so, my hope is just looking at how people are doing things and listening to one another and sharing their findings, sharing the recommendations, and people listening. That's pretty helpful, and acting on it. So
agree. All super helpful and hopeful. And on the note of sharing, we are here at the end. Can't believe it. So I just want to spend a special thank you to everyone who joined, and especially our presenters. I believe someone will be dropping in Niall's work, Dr. Carmen Logi's work, and then Rafia's work as well, links to all of those in the chat box. And then also just a reminder to take the post-event survey if you can. But yes, thank you everyone for joining. This was a really fruitful conversation. I hope you felt so as well.